Stages of herpes zoster disease or shingle. First stage is called as prodromal or the pre-herpetic stage. In this stage, there is no rash appearance, but there is severe burning, pain, itchiness, and paresthesia, that is tingling and numbness in the area. Usually the incubation period is 1 to 2 weeks when the appearance of the rashes occurs. So this period is called as prodromal or incubation period. During that period, there is no appearance of the rash, red rash or the macule, papules or vesicle, they are not present. Second phase of the disease is called herpetic. Herpetic phase. In this phase, there is appearing of the rash, reddish rash in one or multiple dermatomes where there is macules leading to papules, vesicle filled with water which burst and form ulcer, and after during the recovery phase that goes into the scab formation, crusting and scaly one. So these are the various stages of the rash which start from the appearance of the erythematous rash and leading to the passing away of the skin lesions in the form of scales. During this period, herpetic phase, there is involvement of the various critical nerves. The attack of the virus on the nerves, they produces irritation and inflammation that nerves. For example, in trigeminal nerve and its branches. Facial nerve is involved and that leads to the Bell's palsy. Next is the mandibular nerves and maxillary nerve. Maxillary nerve, these nerves, they produces oral or buccal herpes zoster. The blister appears within the oral cavity. That leads to the severe pain, burning, and leading to the mucosal ulceration, which produces swallowing or eating difficult for the patient. Moreover, when there is involvement of the ophthalmic nerve, that is the nerve which supplies the ocular system, eye system, that produces herpes zoster of the eye, in which there is pain, lacrimation excessive, itchiness, conjunctivitis, keratitis, and may pass on to the severe condition of the optic neuritis, papilledema, and the blindness one. Similarly, if vestibulocochlear nerve is attacked by the virus, it is also inflicted by this virus, that is varicella virus, that also produces damage to the auditory system or the hearing system of the human being or of the patient. He may suffer from pain of the ear, then vertigo, dizziness, and may lead into the severe cases, that is hard of hearing or the loss of the hearing power. These are all conditions which are present or appear during the herpetic stage or the second stage or the phase of the disease. The final or the third phase of this disease is that is post-herpetic neuralgias. Even when the I mean the skin eruptions, rashes, macule papules, they disappear after proper treatment. The skin is recovered one. Even when the underlying nerves they are damaged or inflamed by the virus, they produce severe pain, intolerable pain, stabbing pain to the patient for a longer time, from 6 to 1 years, and it needs a careful treatment. Otherwise, it produces a horrible factor for patient life. So, the immediate treatment of the disease to kill the or reduce the symptoms of the virus to start within 72 hours, as earlier as possible. If you want to get rid of this horrifying or terrible disease, you start immediate start of the antiviral medicines to eradicate the virus or to control the virus growth and replication and its results and attack and inflammation to the vital cranial nerves.